Hello and welcome to this video where I, Dr. Madanki from careIVF will be giving an overview of the process of embryo transfer, a very crucial step in IVF treatment. Transferring a fertilized embryo is a very important part in IVF process. The embryo transfer procedure is the last step of the in vitro fertilization process and is a critically important procedure. The importance of a proper embryo transfer technique for a successful IVF outcome cannot be overstated. Ultrasound-guided embryo transfer is the most efficient technique currently available as well as widely used. Irrespective of how well the IVF stimulation cycle has gone by or how good the IVF laboratory culture environment is, the physician doing the transfer can actually ruin everything with a haphazardly performed embryo transfer. To a great extent, the entire IVF cycle outcome also depends on a careful and delicate dropping of the embryos at the proper location inside the uterus near the middle of the center of the endometrial cavity with manipulation. An embryo transfer is required for a couple where natural fertilization is not happening for various reasons and the couple has opted for IVF as a solution to achieve pregnancy. Now, there may be many reasons where such a condition occurs, such as number 1, mainly ovulation disorders seen in patients with PCOS, or number 2, where there has been damage to the fallopian tubes, causing it to become blocked, thereby making it impossible for the fertilization to occur naturally inside the tubes, or the fertilized eggs to reach the uterus or the womb. Also, an embryo transfer may be required in cases where there is poor ovarian reserve or premature ovarian failure. Also in patients with endometriosis and other hormonal disorders, may be genetic conditions which prevent pregnancy from occurring naturally. The presence of uterine fibroids may also be a hindrance and a disruption to the implantation occurring naturally. And last but not the least, where there are problems related to sperm production or quality, count or abnormal morphology. In any case, whatever may be the primary reason, wherever there has been failure of natural fertilization to occur, IVF and subsequently embryo transfer is the best option. So, let us now speak a little bit more in detail regarding the actual procedure of embryo transfer. 2 to 3 days before the transfer, the embryologist chooses the best eggs to transfer into the uterus, but the patient can be prepared for an embryo transfer using various different kinds of protocols. The protocols are essentially used to prepare the endometrium lining, which is most conducive for accepting an embryo at the right time and day. The other criteria for a successful outcome of embryo transfer are also not just the lining, but its quality, as in whether it is a triple line, the measurement of the thickness, the vascularity, that is the blood flow, and also the measurement of hormones preceding the transfer like estrogen and progesterone. Now, it is also important to optimize the other parameters of the patient before a transfer is planned, such as her hemoglobin, her blood sugars, thyroid levels, a hormone marker called CA125, and of course an ultrasound to check that the uterine cavity is sufficient as regards the shape, the volume, and also tuberculosis having been excluded, which is very commonly seen in our country. An embryo transfer can be a fresh embryo transfer, wherein an embryo is transferred in the same cycle as the ovarian stimulation and oocyte retrieval. Also, it can be a frozen embryo transfer, where healthy embryos that were not used earlier were kept frozen under optimum conditions in the laboratory. Depending on certain conditions and parameters, embryos may be decided to be kept frozen on day 2 or day 3, or ideally on day 5, when they are termed as blastocysts. In some cases, they may also be grown till the 6th day and then kept frozen. There are several ways in which an endometrium can be prepared and made ready before an embryo transfer is decided. The most commonly used methods are a natural cycle embryo transfer or a hormone cycle embryo transfer. There is also a modified natural way of preparing an endometrium for embryo transfer.